Hello, this is Dr. Gay from First Look MRI, and this is a 41-year-old male with complaints of left hip pain for many months. They had x-rays here that look pretty normal. We can see the left hip joint here. The round ball is the femoral head. Here's the right side, and these are read as within normal limits. There's no arthritis, no collapse, and so an MRI was eventually done. And on the MRI here we can see that there was a finding. So MRI is very sensitive for marrow changes. We can see here the right femoral head, which is this round ball, and the neck here look nice and normal, homogeneous, but the left side is abnormal, prominent edema throughout the left femoral head and into the neck. And below the articular surface here there's a band of low signal, which is abnormal. This is bone sclerosis, thickened bone there. And the acetabulum, the cup it sits in, looks normal. So this is one of probably three things. Number one is avascular necrosis or osteonecrosis, where the bone infarcts and they get prominent marrow edema and eventually the femoral head might collapse. You can have something called migratory osteoporosis, a self-limited thing where you get intense marrow edema and pain and it can migrate to other parts. You can have stress injuries, stress fractures can cause patterns of marrow edema not dissimilar to this. And so we're going to look at this a little bit more closely on another view called a T1 weighted image. So T1 has fat being bright. So this is subcutaneous fat, very bright. Fat in the pelvis bright. You can see the marrow contains a lot of fatty materials. It's pretty bright. And we can see that the femoral head has these bands where we don't see that typical uniform brightness. And these are bands of low signal, bands of bone increased density, bands of bone sclerosis. So these serpiginous bands of bone sclerosis beneath the articular surface. This is classic for avascular necrosis or osteonecrosis, where the bone is infarcting, doesn't have a good blood supply, there's too much pressure in there and the blood can't get to the bone. And so this is AVN or avascular necrosis, and we're catching it early before the femoral head has collapsed. Sometimes they can do a core decompression where they go in there and decompress the bone, give it room, and hope that it can revascularize. And if that doesn't work, then they may need to just replace the hip. But this is a case of avascular necrosis of the left femoral head, again not apparent on the x-rays. That's it. Thank you very much.